Hello, my name is Anvu and my project is providing the homeless youth with mobile devices in the Los Angeles County. My target community is the homeless youth residing in the Los Angeles County. The geographic boundaries include any city in the county, but specifically in the South Los Angeles, Venice, and Hollywood area. There are about 9,000 homeless youth in the Los Angeles area without a home. Homelessness is defined as those who are under the age of 21 years of age and younger who do not have a regular place to stay and or parental supervision. The target health population. At the national level, about 3.5 million teens face homelessness each year. About half of this population face homelessness because they are part of a family who seeks for a home. 20 to 30% of this 3.5 million individuals find shelters with other homeless teens reside in abandoned buildings or sleep on the streets. Determinants of target health problem. Factors that increase the number of homeless youths are consuming alcohol, smoking cigarettes, and marijuana. About 57% of those who are experiencing homelessness and 70% who have been homeless had alcohol in the last 3 months. More than half of each of the above-mentioned population admits to using marijuana. Others experience depression, especially among the female teen population who prostitutes in exchange for food or shelter. About a third of them experience suicidal ideation. Project focused to provide the homeless youth with cellular phones. There are about 3.5 million teens nationwide who currently live on the streets or without a permanent home each year. As a matter of fact, homeless teens are about 2 to 4 times more likely to experience higher numbers in morbidity and death rates in comparison to the general population of the United States. Therefore, it is vital to have social connectedness among this vulnerable population of teens. Having a sense of belonging can ease the mental stress, build confidence, and even help with employment opportunities. One way to link individuals to others is having telephone or mobile devices. The needs statement, community service, and programs available to address target health programs. The community service program that is available for the homeless youth is in the Los Angeles County is the Crossroads of Hope. It was first opened in 1936 and founded by Reverend I.L. Eldridge. It is a non-profit religious-based shelter serving to all men, women, and children during the critical times of their lives. The core value basically states that they promote hope, healthy relationships, and help on personal healing. They are located on 303 East 5th Street, Los Angeles, California. The Crossroads of Hope program provides life-saving meals costing about $2.03 each. The mission statement is providing help, hope, and opportunity to men, women, and children in need. The emergency services by the shelter are the essentials that we take for granted, such as an overnight shelters, showers, 3 hot meals a day, and baggage storage. Other services are education, counseling, and health care. Statistics shows that are about 1,743 students graduating while staying at the Crossroads, 575,000 meals served each year, and about 446 beds per night here at the Crossroads of Help. The needs statement. Barriers and gaps to receiving benefits. Tuberculosis outbreak. The barrier to receiving benefits that was brought to my attention is the tuberculosis outbreak in closed tight spaces like the shelter. Particularly shelters in Atlanta, Jacksonville, Seattle, and Los Angeles have had problems with TB outbreak. The main reason is the lack of constant surveillance of those who fall ill to TB. The 12-week drug therapy for TB is rifampicin. Due to the length of the time required, it is difficult for those to stick or continue with the program. Sample methods for survey administration. The sample I will use for my target is the homeless teens. There are about 4,000 teens each year in the Los Angeles County seeking for a shelter. I will gather a street teen to distribute a questionnaire survey with a gift card incentive. This is an example of a needs assessment survey to assess the youth population while staying at the Crossroads and in the mobile phone program. From rating 1 to 5, where 1 is unsatisfied satisfied, and 5 is satisfied. Question 1 asks, how happy are you after getting off the phone with family and friends? Question 2, how useful is your mobile device? Number 3, how easy was it to find a job when using your mobile device? Number 4, are you more likely to connect with your healthcare provider with your mobile device? I would interview the shelter leader, a public health department employee, and someone from the educational system, such as a teacher, for key informant interviews. The first question I would ask the shelter leader, is there a particular season where you see a huge influx of teens coming in? Is there a job program to help them get back onto their feet? For the public health department worker, what programs are available for your young teen moms? For the educational system, do you notice a particular pattern in their behavior before turmoil occurs, such as losing a home or domestic violence in a home? The 3 focus groups that would have chosen to conduct the needs assessments are those who have grown up in a similar situation, know the area really well, and church members. These members would be a few years older, who have accomplished or pursuing a college degree, so they would be able to give advice while conducting the survey. I would recruit these students at the local college. The primary goal of the intervention. The primary goal of the intervention is to assist the struggling youth to be more connected with their healthcare providers by supplying this vulnerable group with mobile devices for free. The health objectives are to support healthy eating, encourage prescription adherence, stay connected with their healthcare providers, finding jobs, and reaching out to their beneficial social outlets. The implementation plan. For the implementation plan, staff the program with college students to help homeless youth transition in life. I would try to market the program where most homeless youth would hang out, for example, at the homeless shelters and or fast food restaurants with the free Wi-Fi. In order to gain community acceptance, educate the public how essential it is to have these teens to have mobile devices in order to give them a fair opportunity at a normal life. For the outcome evaluation, distribute the cellular phones to the homeless youth. After 3 months of use, give a survey how effective in quality of life when using the mobile devices in comparison with those homeless youth with no mobile devices. Continue with the intervention if the surveys come back with mostly highly satisfied. Here is an example of my logic model for providing mobile devices to homeless youth. The inputs, for example, is hiring human resources to train, have technical assistance and volunteers to run the program, partnerships with cell phone providers and communities that would give teens jobs, providing cellular phones to youth, funding sources such as maybe parents or federal grants, supplies to educate the teens how to use the cell phone, outputs, establishing partnerships around stakeholders, employers, teachers, parents, short-term outcomes, partners identified and activated, mid-term outcomes, increase the number of youth with mobile devices, and the long-term outcomes of this intervention is to achieve a stable living for the teens. Okay, the conclusion is, according to the Pew Research Center, teens report that they feel a sense of belongingness, finding new ways to connect to others, and creating a new support network to deal with stressful events in their lives when using cellular devices. Parents and female adolescents feel an increased insecurity when they have an opportunity to connect with one another. The use of cellular phones does not only have a sole purpose to connect to others in terms of need, but also prevent these youth to succumb to health problems, sexually transmitted infections, poor mental outcomes, victimization, and violence. Therefore, owning a cellular phone can benefit the health and mental outcomes in the homeless youth.